This is Lloyd Bluen, and this is my presentation for week 2, entitled Splitting Anxiety Hairs. The first thing I want to talk about is the key factors that define anxiety disorders. Some things that really set them apart. Anxiety disorders really, you see a person struggling with fatigue. They may be tired for no reason. That tiredness can come from lack of sleep, restlessness, and then they have panic. They have frequent panic attacks, difficulty concentrating, and then anxiety really does affect our digestive system. And it also can affect the hormones, directly affect the hormones that are in our bloodstream, hormones like dopamine, for example. A few different anxiety disorders is generalized anxiety disorder, social anxiety disorder, panic disorder, obsessive compulsive disorder or OCD, post-traumatic stress disorder, PTSD, and then there's other phobias. But let's talk about generalized anxiety disorder first. It is characterized by excessive worry about just pretty much anything. And people who have generalized anxiety disorder, they typically are stressed or have high levels of stress and anxiety every single day. And it would be documented over over a 6-month period in order for it to be anxiety disorder. And it pretty much affects their whole quality of life. And so they may have trouble falling asleep, staying asleep, hot flashes, shortness of breath, diarrhea. Like I said, it can affect our digestive system, feeling lightheaded, bathroom frequently. The next thing I want to talk about is panic disorder. Now, panic disorder is intense surges of anxiety, unexpected, out of the blue. Dr. Lilienfeld says that it can often, between panic attacks, the patient often ruminates about the possibility of additional attacks. So not only are they thinking about the panic attack, but they are experiencing them. So in between those panic attacks, they're worried or anxious that it can happen at any moment. So sometimes certain situations could be avoided by that person, which can really affect their quality of life. The next one I want to talk about is obsessive compulsive disorder. This is really characterized by the need to perform specific behaviors repeated, and it can really take a toll on somebody's life. It's a very time-consuming disorder to have. It also highly distressed because it feels like one's behavior is so repetitive and so controlling that it feels like they have no control over what they want to do, their own behavior. So it really does affect one's quality of life. Post-traumatic stress disorder is something that is manifested by indirect or direct exposure to actual threatened death, serious injuries, sexual, emotional violence. Such events as natural disasters, hurricanes, tornadoes, earthquakes, domestic violence, sexual assault. Those things can really trigger a person to have PTSD. The next one is social anxiety disorder. Now, that is characterized by the fear or anxiety of social situations. A person can be okay when they're alone, but when they get around people, a crowd of people where they feel like they're the center of attention, where they can be scrutinized or ridiculed, then that social anxiety can really affect them. And so to move on, the main difference between generalized anxiety and social anxiety would be how the onset happens. And generalized anxiety, it's pretty much every day. It can be, rush hour traffic. It can be work-related stress. It can be, just a person is under duress and experiencing anxiety each day from a variety of different ways. Social anxiety is a little bit different. And I liken social anxiety to a person that may be like an accountant, where they're working alone pretty much every day. They may have maybe in a small office or a cubicle, and they're fine until they have to do a presentation in front of everyone. Then all of a sudden that social anxiety will kick in, and that person would start to suffer and have this high anxiety that happens to them. Now, why is it important to have specifiers and modifiers present? The main thing is for proper diagnosis, specific diagnosis. So, for example, when a person has generalized anxiety disorder, the doctors want to know, is it happening every day in every situation? Or like in the case of social anxiety, or is it happening only when you are in these high pressure situations? So, for example, if a person is in a high pressure situation, they may have to take their medication at that point, not every day, like in generalized anxiety disorder. And so